I'm Mayor Lyrian Gaylor Baird, and welcome to this community briefing. Joining us once again to provide interpretation is Margie Prop. Thank you, Margie, for being here today. And thanks to all of you for tuning in to learn more about the latest local developments and how to keep yourself and your loved ones safe. City and state tradition returned last week as Lincoln hosted the Girls State High School Basketball Tournament. And thank you to all those who made it a successful and safe event. Congratulations to all the trophy winners, including Lincoln Pius X for its back-to-back championship. After hosting another local mass vaccination clinic yesterday, Pinnacle Bank Arena is back to basketball this week as we welcome the boys' state championships. Good luck to all of the tournament participants, especially our Lincoln teams. We will be able to welcome back more events like this as we continue to make progress vaccinating our residents. And as we roll out the vaccine in our community, we are prioritizing both efficiency and equity. And as we work to get doses into as many arms as possible, we're also working to ensure that our residents can access the information they need to make informed decisions and to receive their vaccine, particularly those who are most at risk of experiencing severe outcomes from COVID-19 infection, those who have been disproportionately impacted by this disease, and those who have questions about the vaccines themselves. Our community partners share this commitment to both efficiency and equity in our vaccine rollout, and together we are taking steps to execute on these goals. The Lincoln-Lancaster County Health Department and its partners continuously have scaled up the size of our mass vaccination clinics to administer the increased number of doses allocated to Lancaster County. And last week, we held a record 4 large-scale vaccination clinics through which we administered more than 9,200 doses. Yesterday's clinic at Pinnacle Bank Arena was our single largest vaccination clinic to date, and we are proud to report that over 8,000 community members received their vaccinations there. And as of today, over 106,000 doses of vaccine have gone into the arms of Lancaster County residents. And you can track local progress on a public dashboard located on our website, covid19.lincoln.ne.gov. And at the same time that we focus on efficiency and continue to scale up the size of our clinics to serve more people, we also do targeted work to ensure that our vaccine rollout is equitable. One example, our health team works with physicians on an ongoing basis to identify some of our most medically vulnerable residents, and then holds smaller clinics to vaccinate those individuals. Another important strategy we're implementing to ensure an equitable distribution of vaccine is outreach to community members who may have questions about the vaccines. And given the questions that we are hearing from a diverse cross-section of our community, we are making concerted efforts to answer these valid concerns and ensure all residents of Lincoln and Lancaster County have the information they need to make informed decisions about their health. We are joined in these efforts to provide answers to any questions about vaccine safety and efficacy by other community leaders and partners. Bryan Health is currently hosting a Facebook Live series entitled On Call, through which local healthcare experts discuss the vaccine and answer questions so that community members can make informed decisions. Tonight at 6:30 p.m., they will be hosting a Spanish language event with Dr. Diana Patera. To sign up, find Bryan Health on Facebook and check their events page. And with making informed decisions in mind, I've invited Dr. Josh Sharfstein to speak with community members about the safety and efficacy of the COVID-19 vaccines during a Facebook Live event tomorrow night from 5:30 to 6:30 p.m. Dr. Sharfstein is Professor of Practice in Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. He formerly served as the Principal Deputy Commissioner of the U.S. Food and Drug Administration, or FDA, and he can offer us some insights and answers to questions about the FDA's regulatory processes that led to the approval of the COVID-19 vaccines. Dr. Sharfstein will answer questions from Facebook Live viewers and a panel of community leaders. And our local panelists include Dwayne Mays of the Lincoln Branch NAACP, Romeo Guerra of El Centro de las Americas, Pastor Tremaine Combs of Mount Zion Baptist Church, and Professor Anna Shavers of the UNL College of Law. The event will air live on my official City of Lincoln Facebook page, facebook.com/Mayor Lyrian. It'll also be on LNK TV, our city government access channel, as well as on our Link TV YouTube channel. And in conjunction with these efforts, the Lincoln-Lancaster County Health Department is holding smaller clinics for residents who are both served by our cultural community centers and who are currently eligible for the vaccine. The first of these clinics was held earlier today at the Asian Community and Cultural Center, where about 130 individuals received their first dose of vaccine. And joining us now is Thuy Ngoc Ho, Vietnamese community advocate at the Asian Community Cultural Center, who assisted at the clinic today. The Good Neighbor Community Center was also a partner, and its executive director, Tom Randa, is also with us. But first up, we'll welcome Thuy.
Hello, my name is Thuy Ho from Asian Center. Today we got a vaccination clinic at our center. Our client very happy and so excited to get the vaccine. So in our center we service immigrants, so we help all the people in need. So we have many programs to help the people in need get any information. So today, I'm so sorry. Our clients so exciting. So I'm so sorry. See, we try to connect to the client to get the vaccine. We have many community like Chinese, Vietnamese, Sudanese. So we come to our client to talk to them, explain to them about the COVID vaccine information. So, and we call them, we talk with them, explain to them. Some people, they just care about the COVID vaccine. But after we explain and give them more information about the vaccine, they're so excited to get it. And we call them, we help them register, how to register. And now today they got the first shot of the COVID-19 vaccine, so they're so excited. They say, thank you so much for health department and the center to give them a chance to get the vaccine. So I think in the future, we will get more information, like we get more communication with the health department to help the client and more people in need get the vaccine and more to protect themselves. Thank you.
Good afternoon. My name is Tom Randa. I am the director at the Good Neighbor Community Center, and I'm also the chair for the Cultural Centers of Lincoln. So on behalf of the Cultural Centers, we are just very excited for this opportunity that there are some clinics that are happening that are helping our community get vaccinated. A little bit about the Good Neighbor Center is that we are located on 26th and Y, and we were established in 1973. We provide basic and emergency needs services ranging from food. We also do clothes, all the donations we get from the community, we're able to give those out. For the past 12 months, we've experienced a lot of challenges. We had to close our shopping floor, and we can't use our volunteers anymore. So some of the things that we're looking forward to is our volunteers and staff members getting fully vaccinated, having them back at the center so that we can start taking donations, having more people come into the building. And another program that we focus on that has helped us become part of the Cultural Centers Coalition is our Middle East and North Africa Hope Project. And today I have our coordinator for that project, and she has an interesting story that I wanted her to share with you and why it is important to get vaccinated. Welcome, Zainab.
Hi, everybody. Thank you so much for the invitation. I can't believe I'm back home in Lincoln, Nebraska. When COVID happened, I was back home. I had just traveled to visit my family and be with them. And a week later, COVID hit the world, and we had to stop. The whole life just stopped there. So I saw firsthand a lot of people got sick with COVID, which is very, very sad. A lot of people died, young and old. In our country, our healthcare is really, really bad. And so it was very hard for us to see that. And then coming here, and there is a lot of, people are worried about what's going to happen, where it came from, and all of that. And we were quarantined there a lot. We couldn't go a lot of places. We had to wear the mask. Sometimes we didn't, but you just do what you have to do. And life was stopped, just like totally stopped. When I came back to the country, December 16th, I felt like I was in a coma, and somebody just woke me up, and the whole world just changed when I came back. And it's just, I wanted to help my community, and I said, well, what's going on? Who's alive? Who's dead? And I was keeping in touch with my community a little bit, but a lot of people were calling me back home when I was overseas. Zainab, where are you? We need information. We need you. Can you please come again? Can you come back to Good Neighbor and open your doors? We need the reassurance that we can still be part of the community. We need help. What can we do in these days, like with this kind of issue, with the pandemic? So I came back, and I was, again, scared of the vaccine. I hear, like other people in my community, people go to Facebook and the internet, and everybody who comes out now on the internet, they call themselves their experts. And don't get the vaccine, you're going to be, in a few years, you're going to be paralyzed, period. Well, who knows what's going to happen in the future? Nobody went to the future and came back and knew what's going to happen. So I talked to Tom, and we're supposed to get vaccinated last 2 weeks ago, Thursday, and I was really, really scared. And I thought, well, you know what? I'm just going to hide in my office, not go be vaccinated. But then I thought about it, and I talked to more people, and they said, well, getting a vaccine, it's a good thing. There is nothing bad in it. Yes, there's, less time they had to be spent in the lab, to make sure, like, it's a good vaccine. But what do? This is what we have. And thank God we're in the United States. We have a good health care that we can get the vaccine and hopefully stay alive and help our families. So I went and got vaccinated. I was really, really excited. Showed that to my family back home and to my clients. And now I'm encouraging all my clients who come to Good Neighbor Community Center, all the Middle Eastern people, to come and be vaccinated. And we want everybody to be part of our community, to stay healthy, hopefully. Some people, yes, they might get sick. I was scared, but you just do what you have to do. So we can open our center again, go to places and feel safe and feel comfortable like before. Hopefully the life can go back to the way that was before. And I encourage all my clients, anybody who can hear me, from my community, from other communities, it's a good thing. There is no pig in it. People think there is pig in it, there is feces in it, I'm sorry. But it's a good vaccine. We should all be vaccinated so we can have the life that we had before, where I love my community. I love to open the doors again of Good Neighbor Center, have all my clients come again. We're a community. We hug, we kiss a lot. We're very close to one another. This has been very, very difficult for us to stay away from one another. Thank you so much for this opportunity.
Hugs and kisses sound so good right now. Thank you, Zainab, and thank you, Tom, and thank you, Twee, for all of your partnership and efforts and for joining us today. Another smaller scale clinic will be held on March 29th at Mount Zion Baptist Church. And thanks go to Pastor Tremaine Combs, Pastor John Harris, and Pastor Brandy Mimitz-Ryam for their leadership and collaboration with our health department in organizing this clinic. The clinic at Mount Zion will help facilitate vaccine access for more of our Black community members who are currently eligible for vaccine per the state's guidelines. And today, we are so pleased to welcome Pastor Tremaine Combs, Senior Pastor at Mount Zion Baptist Church, and Pastor John Harris, the founder and president of Encouragement Unlimited and founder and lead pastor of Kingdom Outreach Ministries. They're here to share more information about their upcoming clinic at Mount Zion. Welcome first, Pastor Combs, followed by Pastor Harris.
I am deeply appreciative of the invitation to be here today. And I come today as a concerned citizen and son of the city of Lincoln, who happens to pastor one of the oldest African American congregations in this city and in this state. I come concerned because throughout America, African diasporic communities have been disproportionately affected by this global pandemic, and the city of Lincoln and Lancaster County are no exception. As a pastor, I am charged with the spiritual, emotional, and physical well-being of the souls entrusted to me. And part of this charge involves advocacy and advocating that people have access to accurate information and opportunities for care. At our February 10th virtual town hall, in conjunction with not just Mount Zion, but multiple organizations and community partners, we sought to provide accurate information regarding the various COVID-19 vaccines and the opportunity to build trust between the African diaspora communities in the city of Lincoln and our public health officials. And now we are moving forward with access to opportunities for care. Mount Zion will be partnering with city and county health department officials and human services to serve the African diaspora communities of Lincoln on our March 29th vaccination clinic. That will be from the hours of 3 to 7 p.m. and it is going to be at the Mount Zion Baptist Church. This is not about pressuring anyone to get the vaccine. It is not about pressuring anyone to do anything, but it is about providing an opportunity for those that are willing and for those that are able to get care for themselves so that they can take care of themselves and take care of the larger community. And so I'm appreciative of this opportunity to partner with our city officials. I'm appreciative of the opportunity to partner with other various ministers and Black pastors in the community. And I'm so thankful also to the Mount Zion community for opening their doors to our larger community. And we are so appreciative for this opportunity to serve not just the city of Lincoln in general, but the African diaspora communities of Lincoln in particular. Thank you.
What he said. Well, it is a privilege and a pleasure. Thank you, Mayor, and Pat Lopez, who we met with not long ago. I come representing not only Encouragement Unlimited and Encouragement Kingdom Ministries, but also the Black clergy of Lincoln. We've been meeting for quite some time now, for months, and as the pandemic continues to be at the top of our list of things to talk about and to discuss, we know that as African Americans have been disproportionately affected by this pandemic, that as pastors we must advocate and we must do what we call the three E's. We must educate, we must equip, and we must empower the people who are part of the community that we are responsible for to be able to make a sound decision relative to the pandemic. We know that there are several camps associated with the pandemic. Of course, there's the camp that says, I don't want anything to do with it. Don't ask me about it. But there are those other two communities that say, listen, if I can be informed, if I can be educated, if I can know more, then quite possibly I will move forward with getting the vaccine. And then, of course, there are the ones who say, hey, listen, shoot me now. Go ahead and get me. And so, but one of the challenges we face and one of the questions I continue to ask, particularly as it relates to African Americans and other Black and brown people, is that since we know that we are indeed the most vulnerable population, where is the prioritization relative to the vaccine for our community? And so I just want to charge those who are responsible at the state level. We know it comes down from the federal level. The state gets the vaccine and then distributes it. I want to make sure we show the compassion at the federal and the state level to be able to make sure that people who are disproportionately affected will know that they are a priority. It must happen. We know that there are rules, we know there are regulations, we know that there are guidelines, but we need some flexibility so those who are yet most affected can get the vaccine, indeed if they want it, as soon as possible to stay alive. So that is our charge, that is our call, and I thank Pastor Combs, who is a part of the Black clergy of Lincoln as well, Pastor Brandy, Pastor Jesse Miles, Pastor Janet Banks, and others, who, as we partner together to be advocates for the people we serve. And so we're thankful again, Mayor. Thank you, Pat Lopez, and all who have yet been involved in this effort. We continue to journey together. God bless.
Thank you so much, Pastor Harris and Pastor Combs, for your leadership and your partnership in this shared effort to protect the lives of all of our Lincoln residents. And our health department will schedule additional small clinics in the coming weeks, including additional vaccination opportunities for our Spanish-speaking residents who are currently vaccine eligible per state guidelines. Olga Caicedo Health Program Manager at El Centro de las Americas, joins us today to speak about ensuring vaccine access for Hispanic and Latino residents. Welcome, Olga. Thank you for joining us today.
Good afternoon. Thank you so much, Mayor. Thank you so much, Pat, and thank you everyone that is involved on this great activity to promote health in our communities. A little bit about Centro. El Centro was well known as the Hispanic Center and was founded in 1982 and became a nonprofit organization in 1983. Right now, we have more than 35 years of services in the community, and our purpose is to provide education, to family support, and focus on youth. We have an array of programs that helps to empower our community, and right now, on this uncertain time that we're living, we are very proactive with the COVID-19 vaccination and vaccines at large. Giving information, we have so many questions, we have so many concerns that people are willing to have those responses, and we are partnering with the County Health Department to provide all that information with all the information that we have received through the CDC, and it's amazing the response that we're having right now. Along with UNL, we are having the COVID-19 survey that we are also finding the resources why our people is hesitating in taking the vaccine. We are also partnering with the County Health Department. We already have 3 sites already defined. We are working in establishing the dates. Center for People in Need and Community Action is willing to hold clinics with us, and we need to see how available is the County Health Department so we can work together. Also, the South Baptist Church is also willing to have a clinic with the Latinos in the church. And the Cristo Rey Church is also confirming that we would like to work together in vaccinating our community. All this is the effort of the community, our center, and also all our sister organizations. They were supporting one another. Our people is responding, and we have been impacted. We're not different than any other community. We have been impacted not only in health, but also in financial resources. So all this is bringing a little bit of hope to become normal again. I don't know it will be normal again, but well, at least we are giving it a try. So this is our mission, this is our purpose, and we are always seeking for a service that is not only on the language, but is also providing the knowledge about the cultural barriers that we're facing, and that people can understand why our people is hesitating. It's not that people refuse because they are limited, but it's because they have to embrace the cultural belief and the cultural sensitivity, and those you will find in our offices all the time. Thank you.
Thank you so much, Olga, for your leadership and work to address cultural barriers. We appreciate your partnership. And before I turn this over to Health Director Pat Lopez, who is leading our community's efficient and equitable vaccination efforts, I am pleased to share that we have had no COVID-19 deaths reported in our community for the past 10 days. In fact, last week, February 28th through March 6th, was the first full week with no local COVID deaths since the week of September 27th through October 3rd. That is a very positive sign that vaccinating our most vulnerable residents is keeping people out of the hospital and saving lives. And here with more information on our community's progress is Director Lopez.
Thank you, Mayor. It is great to work with so many wonderful community partners to make the vaccine more easily available for those who want it. This outreach is so important to us. We appreciate the assistance and support greatly. I want to again thank all of our partners for helping us better serve our whole community. As the mayor mentioned, we have now completed 106,000 vaccinations in our community. We made considerable progress last week when we held a record 4 large-scale vaccination clinics in 2 new locations. At Speedway Village, we had a first dose clinic for residents age 70 and older, and 2 second dose clinics for residents age 75 and older. The 4th clinic was for educators at the Center for People in Need, and about 9,200 residents were vaccinated at these 4 clinics. We also partnered with Bryan Health to hold a clinic to vaccinate patients with very serious health conditions. This week, we expect to receive another 8,200 doses of Pfizer vaccine. We don't expect any more Johnson & Johnson vaccine until later in March. We'll be vaccinating additional residents in Phase 1B and those who are being scheduled for second doses. We're off to a very busy start. Yesterday, we returned to Pinnacle Bank Arena for our largest clinic yet. Over 9 hours, we vaccinated more than 8,000 residents of our community. We had 50 nurses giving vaccinations, 13 physicians screening, and over 100 other volunteers and staff assisting. Each and every person helped make a clinic a success, and we thank them and all the members of our community who came to the arena to get vaccinated. As Thuy mentioned, we worked with the Asian Community and Cultural Center to host a clinic this morning, and most of those vaccinated were older adults. At 4 this afternoon, we are starting a second clinic for our educators at North Star High School. We will be using some of the single-dose Johnson & Johnson vaccine at this clinic. All 3 vaccines are safe and effective, and we continue to encourage people to get the first vaccine that is available to them. We will also have 2 clinics at Speedway Village this week. On Thursday, we will have a second dose clinic for residents age 73 and older, and on Friday, we will vaccinate residents age 65 and older, as well as some educators. We are also working with Bryan Health to hold a second dose clinic this week for patients with serious health conditions. After the vaccination of educators is largely complete, we will move to child care providers who are next on the state's priority list. Later this week, we will be reaching out to child care providers to help ensure those who are interested in receiving vaccine are currently registered. We will be providing specific registration links for centers and individual providers. As we receive more vaccine, we will continue to expand vaccination to others in Phase 1B. You can find the latest vaccine information at covid19.lincoln.ne.gov. That site includes a list of all the priority groups in each phase and who we are currently vaccinating. We do have some additional information to share related to the federal retail pharmacy program. The federal government is leading this program and collaborating with states, national pharmacy partners, and independent pharmacy networks. The goal is to increase COVID-19 vaccinations across the country. It's rolling out incrementally based on available vaccine supply. Hy-Vee is now participating in the program here in Lincoln, so we now have 2 pharmacies in our community providing vaccine. Actually, the Hy-Vee pharmacy is splitting their doses between all 5 Hy-Vee stores in Lincoln. Our other pharmacy is RelyCare. Both pharmacies are receiving weekly allocations from the federal government and have limited vaccine supply. Their allocations are in addition to what the health department receives. The president announced last week that the federal government would use the pharmacy program to help prioritize educators for vaccination. Hy-Vee is currently scheduling appointments to vaccinate pre-K through grade 12 school staff and workers in child care programs, 65 plus, and healthcare workers who provide direct care to patients. RelyCare is vaccinating those 65 plus, as well as new long-term care staff and residents of these long-term care facilities. If you haven't already, it's important to register to receive vaccine. Use the secure online form at covid.lincoln.ne.gov. The form is available in English and Spanish. As doses become more available, those who are registered will be contacted to schedule an appointment to get vaccinated. Registration is open to all county residents. Those who do not have online access or who need assistance may call the COVID-19 hotline at 402-441-8006 to register. Our health department also has interpreters available to assist callers who speak other languages. Also yesterday, the CDC released new guidelines related to how fully vaccinated people can visit safely with others. We're in the process of reviewing this guidance and will be providing more information in the near future. Now turning to our COVID-19 risk dial update. Our indicators have remained fairly steady, so our dial position will remain in the mid-yellow, which indicates a moderate risk of the virus spreading in our community. The 7-day rolling average of new daily cases shows that from February 14th to March 6th, cases have fluctuated between 44 and 53. For 4 straight weeks now, we have had fewer than 350 weekly cases. This past week ending March 6th, we had 324 new cases. Our testing continues to be down. Over the past 3 weeks, we have seen an average of about 1,500 tests per week. The number of COVID-19 patients hospitalized locally remains steady at about 40 per day. Over the weekend and today, we have seen an additional decrease. Today, we are reporting 25 individuals hospitalized, with 14 from Lancaster County and 11 from other communities. This is the lowest number of hospitalizations since August. One indicator we have seen a decline in the past 2 weeks is the positivity rate. The rate has dropped from 23.9% the week ending February 20th to 18% the week ending March 6th. More cases of the variants have been confirmed within the state. According to the Nebraska Department of Health and Human Services, 5 cases of B117 COVID-19 variant and 14 cases of B1429 variant have been identified in Nebraska to date. Lancaster County confirmed its first case of B1429 on February 27th. It is very likely we will see more local cases related to the variants, and that reminds us of the need to remain cautious. It is critical that we continue to take preventative actions that have been proven to slow the spread of COVID-19. Wear a mask, watch your distance, and stay at least 6 feet away from others. Wash your hands, stay home if you're sick, and avoid crowded places and close contact and confined spaces. Get vaccinated as soon as COVID-19 vaccine is available to you. And before we open this up for a few questions, I do want to mention that we are not making any changes to the current local directed health measure, and we are expecting it for the next month to remain the same to April 12th. With that, we'd be happy to take questions from the media.
Director Lopez Riley with the Journal Star.
Yes.
Hi. At this rate, when do you foresee finishing up with the sort of priority age groups in 1B and moving on to those in the next, younger groups?
Well, Riley, it depends on how fast we start moving through. We're able to move through the educators. We started on 65 and older yesterday at Pinnacle, and we're doing additional 65 and older this Friday, and we'll be able to reevaluate how many individuals are left in that age group before we move on. Our educators, we have an estimated over close to 15,000 in that group that need to be vaccinated, and we probably have another close to 13 or 14,000 in the other groups in 1B that follow educators.
Director Lopez, a follow-up question just to clarify. Are the smaller clinics in partnership with the community centers, are they working off the registry with the health department, or is there some sort of work by the cultural centers to identify people that they serve that fit within the priority groups of 1B?
You know, our health department has had a close working relationship with the cultural centers for many years, and especially prior to COVID. And so during this whole time, we've been working together. And the staff at the cultural centers work directly with us, and the individuals receiving the vaccine are registered in the same manner, and we're providing the vaccine there with the assistance of the staff at the cultural centers. And that will be the same registration we'll do for all of the clinics.
Director, this is Brent with Channel 8. Kind of a follow-up to Riley's first question. If we're looking at about 28 to 30,000 more people in 1B, at the current rate, would that be about 4 weeks away from phase 2, or will the not getting Johnson & Johnson slow that down?
It's probably going to be 4 weeks. You know, Brent, everything we estimate on and look at, and some people have received the vaccine during this time and some people choose not to get it, but the overwhelming majority of people we're reaching out to, over 95% of them want the vaccine. So it could be another 4 weeks. If we finish the 65 and older, the direction is then that we give 10% of the vaccine to those 50 to 64 and finish out the rest with 1B. So if we're getting 8,100 vaccines a month, of course it will go much sooner. We're prepared to do that should we get to that situation.
Just a couple quick viewer questions we had, if you could answer. Some people are asking, what should they do if they were notified about being able to get the vaccine and for some reason missed the notification? Should they register again, or should they just call the health department? What should they do in that situation?
I really appreciate that question because if somebody didn't respond or missed that opportunity, they will get another opportunity, and we will be reaching out to them again. And I would encourage people, if you think you're in the age group, by looking at the website, and we're doing 65 and older right now, that age group, check your spam mail or junk mail, because sometimes that's where the invite is going to, if you gave us an email address to use.
We've also had a couple people reach out with some concerns about the vaccine clinics. Some people expressed concern that there wasn't appropriate masking or social distancing at some parts of the clinic. Could you maybe respond to that?
I can respond to that. You know, the social distancing is something we work really hard on and have to remind people. You know, and again, we still have people that we have scheduled times, and people are still coming much earlier than their appointment time. So that's something we manage, and we're going to adjust. I have to say, I never encountered any masking issues in the clinic at any point in time, and I was in all areas of the clinic. I haven't had any staff tell me that either.
Thank you.
Any other questions? Thank you.
In closing today, we just want to say thanks once again to our guests for their leadership in the effort to vaccinate our community efficiently and equitably. Thanks to you as well, to the collective efforts of so many. We are making excellent progress in this comprehensive effort to protect lives and livelihoods. All of you are leading by example and slowing the spread of the virus and its variants by wearing masks, washing hands and watching your distance, and by avoiding close contact, crowded places, and confined spaces. And these steps, combined with our efficient and equitable vaccine efforts, will see us through this tunnel we're in, all the way to the long-awaited light at its end, a light that is getting nearer and brighter with each passing day. Thank you so much. Thanks.